Obama's war on doctors. There's really no other way to characterize what's going on in this administration and its attitude toward the medical community. It literally is an effort, almost like a cattle drove in the Old West, to herd doctors away from independent practices into hospital-dependent practices where they essentially are 9-to-5 employees. In 2010, 2/3 of all American doctors said they were independent. Now only 1/3 say they're independent. The rest are involved with and dependent on hospital chains. The reason the administration is doing this is it's so much easier to keep tabs on them, to regulate them, and frankly to remove any level of artistry in it and making them just robotic mass production machines. One of the big ways the administration forces doctors into hospital settings so they can't practice independently is because they give twice the reimbursement rate for most procedures in hospital settings that they do in non-hospital settings. A colonoscopy, for example, will get about $350 reimbursement if it's done outside of a hospital, but if it's done by a doctor inside the hospital, it's about $650, and the same applies to a wide range of procedures. So doctors are basically sacrificing their independence, driven by the very low reimbursement rates they get on the outside. The other thing that's going on is the record keeping and electronic medical records requirements are so onerous, so burdensome, that independent doctors just can't keep up. They can't keep up with the record keeping. They can't get the equipment necessary and the software necessary to do it, except at great expense. And it consumes a huge portion of their day if they're not affiliated inside of a hospital setting. All of this has to be seen against the backdrop of the fundamental fact, which I've said since the start of this fight over Obamacare, that you cannot expand the number of patients by millions and millions and millions and not expand the number of doctors. And in fact, when you lower their reimbursement rate, you change their working conditions so they're not entrepreneurial, you slash their income dramatically, you're driving people out of the medical profession. And we're now facing an acute shortage of primary care physicians, particularly in areas outside of the major cities. The medical community estimates that shortage by 2020 will grow to 60,000 doctors as a shortfall, about 10% of the total number of doctors we have now. We would need to expand it by 10% to meet the entire demand. One of the big reasons for this shortage is that Congress won't expand the number of residencies available. And basically that means you can't have a third and a fourth year of medical school unless there's a hospital nearby that has a residency program in which the medical student can participate. The reason Congress won't expand it is that the residencies are basically funded through Medicaid and Medicare, which give a higher reimbursement rate to a teaching hospital than to a community hospital. And the government doesn't want to pay for the increased medical education, doesn't want to pay for the increased number of doctors. Where is all this leading? Away from doctors, toward physician assistants, nurse practitioners, ER treatment, and really away from quality medical care. It's a terrible trend.